Welcome everybody. Thank you for attending our event and your interest in this topic. We are going to discuss today, as you know perfectly, I suppose, drug consumption rooms in Europe, and we have several speakers. We have Jane Montenay from the European Union Drugs Agency giving the general overview. We will have Dennis Huber from the Pompidou Group of the Council of Europe, also addressing the more general aggregate level situation. Then Susanna Ronconi from Forum Droga will talk about the legal frameworks of drug consumption rooms in Europe, and then we will have two presentations of specific drug consumption rooms, one from Portugal, from Lisbon, from Hugo Faria, and then the other from Brno, from Viktor Mravchik. Yes, I'm not in the best shape to have a very long speeches or presentations today, so without further ado, I'll just give the voice to you and floor Jane. Thank you.
Thank you very much, Iga, and it's lovely that you're here with that voice, and much appreciated. A pleasure to be invited to open this side event, and it's really important. It's an important area for us at the European Drug Agency, so thank you. Okay, this is if you like a starter before you get to the meat and perhaps some of the more interesting topics, but in the European Drug Report last year, the context within which we opened a discussion on drug consumption rooms was the evolving drug problems facing the European Union and the challenges, broader challenges for harm reduction, that we're seeing complex harms, new challenges, in particular around synthetic substances and around stimulants. We note that all member states in Norway, the countries we work with, have got harm reduction interventions, including opioid agonist treatment and needle and syringe provision, though coverage varies greatly, and that there are a range of newer services in the European countries in this area, drug checking, take-home naloxone, and, as we're discussing today, drug consumption rooms. And 13 countries in our latest data within EU and Norway had drug consumption facilities, one or more. And we also noted that there's a need for further research and evaluation to develop the policy basis for the rooms and for policymakers. So, European picture, here we go. And I think one thing that's actually really interesting was that the EU Drugs Action Plan for the first time called for drug consumption rooms to be introduced. And that's really important that we actually in Europe have that as a sort of a link point there. Introduce, maintained or enhanced where appropriate and in accordance with national legislation. And I think, as we may hear later today, that in some countries drug consumption rooms are not currently permitted, but they're actually been around for a very long time. The first was in Switzerland, opened in '86. Since then, as I said, the 12 EU member states have introduced them. Kind of quite a nice image here, which is over time, and it shows where different harm reduction interventions have been introduced in European countries. So as you see, drug consumption rooms, that's the green line. They're one of the most recent types of interventions to be introduced, and they're still at a slightly lower level than take-home naloxone, for example, or for drug checking facilities in terms of number of countries with these. So the adoption rate's low, and we do notice that some of the projects have been quite vulnerable. They've been pilot projects and they've been trying to get in. So it's an area where we think more investment is important. We've had quite recently published one of our mini guides. We have a health and social responses European guide with lots of different areas that we focus on. And one has been specifically on drug consumption rooms. It's on the left here. It covers broadly a sort of description of what these are as a service, what typically they provide, who they target, what their objectives are, and also what does the evaluation, what does the evidence say about what works, and what are the challenges for the future. And I'm not going to go into it in any great detail, but as you well know, there's in Europe and elsewhere, there are many different models of service delivery and diversity in programme design. And whereas the original rooms that were developed were very much focused on heroin and drug injection, there's been a lot more innovation and a kind of differentiation in types of services and the services that they also provide linked to different forms of drug use and drug behaviours. Many services are integrated in existing health services and they're part of a broader treatment or harm reduction portfolio, but others are specialised and maybe standalone, perhaps with a narrower range of services. And as we may or may not hear today, there's also outreach vehicles as another mode of service delivery. I think one of the important areas for drug consumption rooms has been to kind of prove, that they work. Because they're a new service, by the nature of a new service development, there's not as much evidence around. It takes time. So with opioid agonist treatment, we've had very many years to build up an evidence base. This is more of a new development area. But in the mini guide, we show what evidence is available. So we've provided an overview, and a lot of the evidence was actually originally from outside Europe, from Canada and Australia. But there is quite a significant amount of evidence now of the beneficial effects for a whole range of different objectives, many linked to reducing drug-related deaths and risky injecting behaviours, as well as the evidence to show that they do not increase crime. What you'll see on the right, though, the quality of the evidence, as I said, is still quite low. It's a developing evidence base. We really need more research and studies, and I think drug consumption facilities themselves are asking for help to build this database. This diagram just shows the whole range of different services that may be used in, let's say, a city or a country to try and reduce drug-related deaths, particularly linked to opioids. And they come in at different levels, reducing vulnerability, reducing the risk of an overdose occurring, and if an overdose occurs, reducing fatal outcomes. So again, you're thinking, what aims? And I do actually think the drug consumption rooms have a role in reducing the risk of overdose occurring as well. But most of the evidence is, where there's good evidence, is that they reduce fatal outcomes and have the ability to reduce fatal outcomes if overdose occurs. A little bit more discussion that I'm aware of is, okay, so what's the evidence base in relation to infectious diseases and transmission here? There is evidence that they have an impact on injecting risk behaviour, but the evidence is quite limited. Not much has been collected on actually directly impacting hepatitis C or HIV transmission. This was a very sort of major literature review with ECDC and our agency looking across the evidence, and there was a panel of experts. And here, because there was such a low availability of evidence, we had expert consensus, and this was their statement that we've reported in the guidance, that so in relation to infectious diseases amongst injecting people who inject drugs, provide supervised injecting facilities in order to reduce injecting risk behaviour among people who inject drugs, which could, as a consequence, contribute to prevention of HCV and HIV. Just to sort of finish, we've got a great partnership at the EUDA with the European Network of Drug Consumption Rooms, and we've been working quite closely with Correlation in particular on this. We're developing routine data collections in a number of drug consumption rooms that are interested, looking at study protocols, harmonising the way they document and collect data, looking at the quality. And we want to use this to support the evidence base. And the other stream of activity which follows on from this is working on evaluations. We have Marie, I think, in the room. Hi Marie, who's been helping us looking at an evaluation toolkit and working with drug consumption rooms on this. And again, for us, supporting the network development annual meetings is really key. So in the pipeline, we're hoping to have this evaluation of drug consumption rooms, a 7-step guide, where we're looking to support both DCR managers and local decision makers how to evaluate their services to support their planning and to support their ongoing funding. We've got quite a lot of information and publications, so if you want to go to our EUD website, you will find, as well as the mini guide, quite a number of different publications on this topic. And just to finish, this comes at the end of our mini guide, and it's a little bit interesting. What are the implications here for drug consumption rooms? What are the opportunities? Well, it's a small number selection, but they really have, from our perspective, a great role in providing early insights into new trends because of the working with people very much on the front line. Early patterns changes when we're thinking about preparedness, synthetic opioids. I mean, drug consumption is really kind of key from that perspective. And also provide opportunity for research and development in terms of cutting edge new interventions and responses. Gaps, as I said, we need to support you to improve the evidence base. Implementation research will be really important, and guidance to inform decision makers on how to actually establish and implement these. And interesting from our point of view also is alternative delivery models and work done for specific target groups, whether migrants, women. We know there are interesting developments here. So thank you very much, and look forward to the next presentation.
Yeah, I think just let's keep it on the last slide of Jane, I think. Yes, thank you very much, Jane. I think it's very important what you said about the need of more evidence, that this number of research is relatively low at the moment. And I think, just from kind of own observations, that there has been in Europe, especially recently, several kind of places or streams of researchers that are looking for it. One of them is, of course, the DCR Sentinel data collection that ENDCR does in collaboration with the EUDA, but there is also work on evaluation of one of the ENDCR working groups, and also work on the minimum indicators, outcome indicators that Dr. Gillian Scholte is doing in Queen's University, Belfast. So, yeah, Marie?
Sorry for interrupting, but I have a short question regarding the evidence that is considered as low, because perhaps it has been considered as low before the publication of the evaluation that we did in France, because in France we did an evaluation with a control group, and to have a higher evidence we need to have a control group. So it seems to me that as we now have more and more research that have a control groups that compare people who have access to drug consumption room with people who don't have access to drug consumption room for overdose prevention and HCD, now the evidence can be considered as higher compared to before. And perhaps when the evaluation of the strengthness of the evidence has been done, this paper with control group haven't been published. So it seems to me that now, as we have control group on HCD and overdose, the evidence can be considered as higher. In the French standard, we did a consensus expertise with the National Institute of Health and Medical Research, and we decided to take into account for having a good evidence to have control groups. So that's why I put this topic on the table. That's recent evidence, but perhaps we might consider it with, and I know that new evaluation will be done in other countries with control groups, so that will increase the evidence. So just to add this in the discussion.
Yeah, thank you for this contribution. I think that, yes.
I mean, I could just say I agree. We sort of globally, we had a global review. The Australians did a global review of the evidence across many domains, including this one, but it needs to be updated. This has actually changed since the first time, so it is something. The evidence in this area in particular is increasing, so it's going to.
And the publications are recent, but so perhaps they were not in
the original review.
Yeah, with the political discussion, I think that it's important to put that into the debate.
Thank you.
Let's move the rest of the debate after all of the presentations. Okay. So Dennis, could I ask you to take the floor now? Thank you.
Yes, thank you. I think Jane has made an excellent introduction to the current state, the current situation of drug consumption rooms in Europe. As she said, there are already, I don't know exactly what word to choose, 13 European countries which are using drug consumption rooms. Which means that still today a majority of European countries don't have drug consumption rooms. And when I speak about European countries, I have a wider prospect than Jane because, as you know, the Council of Europe has 46 member states. And we have, as Pompidou Group, in addition, we also have Mexico, Israel, and Morocco. So that means that there is still a lot of work to be done to explain to our member states the advantages of having drug consumption rules. There is also advocacy to be made to push forward the importance of harm reduction. We had recently a big discussion when we have discussed this policy paper on bridging human rights to the heart of drug and addiction policies, and one of the issues which led to quite not tense but lengthy discussions was the issue of harm reduction. At the end, there is a very strong message in the document about harm reduction, but there was in the previous version a specific reference to drug consumption rooms as a tool, important tool in harm reduction, and this reference disappeared. So we will continue as Pompidou Group to raise awareness about drug consumption rooms. We have started to do so as of 2019. In 2019, the City of Strasbourg and the association ITAC, which is running the Strasbourg drug consumption room, has decided to organize a European seminar on drug consumption rooms, and I was invited at the time as a speaker. And then it took place at the European Parliament, and then we had discussions with the City of Strasbourg and the ITAC Association about not having just a one-shot European seminar, but making it a process. This means having every 2 years a European seminar on drug consumption rooms under the auspices of the Pompidou Group, the City of Strasbourg, and the ITAC Association, so we can every 2 years see what has changed, what are the progresses, what are the difficulties, and also bring together people who are running drug consumption rooms throughout Europe to have also peer-to-peer exchanges. Of course, they do so in other places, like in Correlation Network, for example, at the UDA. We are not the only ones who are doing that, but we have had a second seminar in 2021, which brought together more and more people, and the third seminar in 2023 enlarged the scope of our discussions, because we have also had discussions with representatives from other continents. We had online, we had people from Australia, from Canada, from New Zealand. We even had some people from the US at the time. They were trying to create a drug consumption room in Philadelphia. And they explained to us the difficulties they were facing, even under the Biden administration. So I cannot just, I will not even try to explain you what is now going to happen with the new US administration. And we will continue this process because it has also proven to create results. For example, I was told by the Irish permanent correspondent in the Pompidou Group that the participation of the Irish Minister of Health in the 2021 European seminar has led to the creation of a drug consumption room in Dublin. So advocacy, awareness raising, it's something which is important and even sometimes works. I will finish by inviting you to the next European seminar on drug consumption rooms, which will take place on the 18th and the 19th of June in Strasbourg at the hemicycle of the Council of Europe. So it's a big event. And we will focus, we have a larger scope for this time. We will focus on harm reduction and drug consumption rooms as an important tool of harm reduction. And for the first time, we will have a session on Europe. What's the situation in Europe? It has been already very well explained by Jane. We will have a specific session on France. Marie has already touched the issue. There are some problems right now in France. France has 2 drug consumption rooms, but the current French government is not really in favor of drug consumption rooms, and there are threats that these 2 drug consumption rooms in Strasbourg and in Paris may not be able to continue after 2026. And we hope that the seminar will help the French authorities to be more convinced, even if evidence shows that these rooms are creating advantages. Marie referred to a recent report by the IGAS, which is very positive, but apparently the French government is not so keen in following these recommendations. So we will have a specific session on France, and for the first time we also will have a session on looking it from a global level. We will have the UNODC, we will have the Human Rights High Commissioner on Human Rights, and also the Global Commission on Drug Policies, to see how these issues, harm reduction, drug consumption rooms, are being looked at from a global perspective. And I think I can stop there. Thank you. And thank you for Correlation Network for organizing this side event and for being a partner. Also, EUDA is a partner of these processes of European seminars every 2 years in Strasbourg.
Thank you very much, Dennis. And I think that your presentation of Susanna now very well will fit to kind of go a little bit more into details regarding this legal and policy environments and contexts of DCR in Europe.
Okay, thank you, Iga. Hi all. I come from Italy, that is just one of the many countries where DCR are not yet established. And so Forum Droge, which is my organization, asked for the support of the European DCR network just to try to have a new tool for our advocacy action. In Italy, we have been trying to solve the problem for 12 years, I think. We adopted every kind of advocacy action, from scientific conference to public demonstration and so on, but we were not successful. So the idea was to have a map of the legal obstacles from one side that each national context have to cope with, and on the other side the strategy, political and legal strategies that each context adopted to solve the problem. So these were the aims of this research. The aim is to have this map not to find directly a response, because each legal context is different, so not every strategy fit with each context, but it's a first step just to have an overview and to be able to make a comparison and see if there is one strategy already adopted in some context that could be useful and adequate to our national context. So we make a research through an online questionnaire, just thanks to the support of the European network. And we have responses from 11 DCR, from 10 cities, from 10 different countries. I have no time in a few minutes to give you all the result of the research. I invite you to read the report that is going to be uploaded in the Correlation website in a few days, I think. but I can say shortly something. We see that in 4 contexts there are no legal barrier asking for a reform of national drug law or penal code. And this is interesting, that I want to say something later about that. In 4 countries, there are a problem dealing with the possession of drugs for private use, and there are countries where this kind of behavior is a penal crime, of course. In one case, the legal problem was fostering the use of drugs. In another case, permitting the supply or consumption of drugs, dealing with making a space, a room available for this kind of behavior. And in one case, there was a problem dealing with unauthorized practice of medicine or nursing. We verify what we already know, that since 2016 there is no legal barrier due to international convention, while before that year there were a big discussion about that, but this is not a problem now. And this is the map of different strategy adopted. I have not the time to describe it, but we can see briefly something that in some contexts it was necessary to make a reform of a drug law. I mind the case of Greece, for instance. In other contexts, it was not necessary, and for instance, it was useful to have the opinion by a general attorney in a city or in a region, or in other situations, I think like France, there was a pilot program or a scientific experiment giving a temporary legal exception to the law, to the drug law. Or in the more positive case, it was enough to include drug consumption room in the general harm reduction systems without the need of any legal change. And what is interesting, in my opinion, in some cases, there were some changes, but not in the national drug law or penal code, but in a so-called secondary legislation. I mean, there was changes, for instance, in the guidelines dealing with the health system and health services. In the report, you can read more in depth the description of these strategies. I want to stress something. Of course, I read this map in an advocacy action perspective. So what I want to stress is that it is not always necessary to resort to a national drug law reform. And I want to stress that also in the case of the first 4 contexts where no reform is necessary, this doesn't mean that the law didn't pose any obstacle. I mean, it is important, the law, but it's also important the interpretation of the law. That is not a technical issue, but a political one. So I think we can learn something about that. I stress again that it is possible to intervene on health legislation, and of course, all that is easier in countries that have a clear harm reduction strategies. In that case, it's more easy. It is easier to say where DCR are a new step in an already established health strategies. And again, it's possible to work on the level of secondary legislation like local or regional protocols or health ministry decrees and so on. It is also interesting the role of the local administration. In some cases, the first establishment of DCR happened at municipality level or at regional level with specific regulatory laws, local laws. And sometimes it was not necessary to wait for national reform. In other times, the local experimentation prepared a national reform that came after this experimentation. Scientific pilot programs are a very complicated mechanism, but they are perhaps very useful in case when we have multiple and many legal obstacles. I want also to stress that operational norms, so how a DCR have to be managed, play an important role because operational norms can help to prevent other legal risks. For instance, the risk of dealing inside the services or the risk of violence or so on. So I invite you to read the report to have a more in-depth description, but I want to conclude with a question. I have the answer, but the question is that after 40 years of experience all over Europe and of evaluation of these services, we continue to cope with legal obstacles. And so the question is, isn't it time to declare that DCR are an essential health services and that we have to remove them from legal rules that should not concern them and their mission? So I have not the answer about who can give an answer to this question, but I think that the question is the right one. Thank you.
Thank you very much, Susanna. We move to example of specific work of specific drug consumption room in Lisbon.
Okay, so thank you. I'm very pleased to be here. So many new faces. So I'm going to talk about our drug consumption room in Lisbon, but also by starting with this question, then, well, in the end you'll see the answer. But so we are an NGO founded in 1986. First of all, we started working mostly with therapeutic community. Just a curiosity. It was we started with 12 clients only. Since then, we have the opportunity to be extending our intervention through the harmonization, prevention, treatment, rehabilitation, and also working with people experiencing homelessness. This is almost a complete package of services that we provide nowadays. So, therapeutic community, the mobile methadone intervention program, the transitional flats, also some employment projects, the shelter where we run a drug and alcohol consumption room, the drug consumption room itself, and also a needle and syringe program near Lisbon. Just to highlight that last year we provided services to almost 3,500 clients, which is, as a curiosity, if we look at the first group of 12 clients 40 years ago, it's a significant change. So our integrated support service, which is the most important name, that has also a drug consumption room inside. It's not only a drug consumption room. Started in May 2021 as a part of a pilot in Lisbon, as a part of a plan that was meant to be to have 3 drug consumption rooms. One is still missing because of the place where it meant to be placed. There was some fight against the beginning. So, but we opened We are in the Lisbon city, not in the central city, which is, for us it's different because our setting is not the center of the city, but a little bit far away, which also means that we have some other challenges. We are not so linked with the city, but it's also something good. So we are not so, how can I say, we have less tension or less pressure from the neighborhood about, for example, when people stand outside using drugs. So this is a place where we are placed. It's a place where the intense trafficking activities is normal, with a high degree of public drug use, people with deficient personal care at all levels, major public health risks, and also a place where we can find social exclusion and stigma. So like any other harm reduction intervention, and even like any drug consumption room, this is the group of the main objectives that we have. So to promote health education and safer drug use, to promote the screening and treatment, linkage to care and treatments, dignity, social inclusion, to reduce the public health risk and social noise, and also to promote the urban hygiene. So to be our client or to come in, we have almost no barriers, so anyone can come if it's above the limit, the legal age of 18 years old. We are client-centered, so we have a very low threshold service and approach. There's no barriers about the substance that people want to use inside, and not even related with the place where people, in terms of injecting, the place where people want to inject. So this is the plan of our room. So 2 smoking rooms and 1 intravenous room, which means that we have 26 places in total for use of drugs. Like I said, it's an integrated service, so we don't have only consumption rooms, but we have also places where people can stand, can eat something, can take a shower, or talk with some members of the team. This can be a regular day. 300 entry in the place, more than 170 different people. They can produce 240 consumptions every day. So since we have opened in May 2021, we have now more than 3,000 registrations, different registrations, which means that it's a very busy place. Mostly men, our population, with an average age around 45 years old, and coming mostly from Portugal, but also from other countries outside Portugal. This is the catalog of all the healthcare activities that we provide in our DCR. Just to say that we believe that healthcare should be an inherent activity in harm reduction interventions, so that's why we also underline this package. So just to say also that even if this is a complete range of healthcare services that we provide, none of those are mandatory, so this is what we put, that we bring, that we provide to our clients, but no one is forced to anything, to do a screening or to do some treatments, anything. So, well, only in overdoses moments we should do something, but in the other examples it's nothing is mandatory. So this is the appointments, all the appointments that we have, the screening for the main infections, treatments for those infections, and also some important part of our work is the referral. So we are very connected with the system around us. And just to my last slide, this is all the healthcare actions that we did last year. And I have some message here, so that's why this time we focus on healthcare, because we really believe that, like Susanne was saying, that sometimes this kind of facilities can act as the only place where people can health or can contact with an health approach with health institutions. So that's why this is so important for us to underline. We also would like to say that we act as mediators between the person and the system. This is a great way to enter the system, but also it's important for us to say that we believe that harm reduction should also be should open doors for those who want to go out in a certain point of their lives. So guarantee basic care and maximum dignity, and also we provide that for those who are usually stigmatized, personal health care, which is also a benefit, nothing new, but it's also benefits for the others. I have that that phrase over there. So emergency care saves lives is nothing new. We know that emergency care saves lives because every time there's an overdose happening inside of our DCR, we have to take care of our client's life. But it's also very important to say that the continuity of the health care can reduce the burden of the disease. So we don't work only on emergency times, but also every day taking care of our clients. So, and that's it. I will stop here.
Thank you, Hugo. I think what is very interesting, what you mentioned, that this element of dignity and community and being together, spending time together, it's not funny. This is also something that I think is a little bit missing from evaluations. So to what extent DCRs are effective in HCV or HIV prevention is one thing, but this kind of more humanistic element I think is also important, and that would also kind of imply the necessity of treating living experience and live experience as an evidence at some point, as a source of evidence. So it's something that probably we should think about for the future evaluations and research on that. Yes, and finally, Victor, can we hear from you? This is the first DCR in Central Eastern Europe opened 2023?
Yes.
Yes, right?
Yes.
So let's hear about that.
Okay. Well, hello. I'm Viktor Mravčík. You might know me as a scientific advisor to the National Drug Coordinator working for Drug Policy Coordination Office in Czech Republic. But my main job now is I'm the head of the research and innovations in the biggest NGO in Czech Republic providing drug services and addiction treatment services. It's located in Brno, in city of Brno, which is not far away from here. It's in the southeast part of the Czech Republic, just 1.5 hours drive from Vienna. And it operates in 3 regions, providing a whole range of services from prevention, harm reduction, drop-in centers, outreach services, the treatment, outpatient, inpatient, and has, I don't know, nearly 400 employees, professionals, 10,000 clients a year in all the regions and services and so on. So it's really big, but DCR was missing in this portfolio, and it was missing in the whole Czech Republic. So Brno is the second biggest city in Czech Republic, 400,000 inhabitants, including university students, even more than 500. We estimate there slightly more than 2,000 people who inject drugs, mostly methamphetamine, but there is specific drug scene in the center of the city, in one marginalized district, with high representation of Roma community there, with commercial sex, with high hepatitis C prevalence, and there in this community is very high proportion of heroin users, so or people using heroin. Yeah? So there is also high occurrence of injecting in public places, drop needles in parks, on the ground, and so on. There are harm reduction services operating in the district, but DCR was missing. Here you can see the real pictures from, I don't know, 2024, yeah, from the district. So you can see the signs of use on the street and the use and dealing on the street and so on. So on the DCR, we simply start with the idea in December 2021. The preparation started. We compiled the, let's call it, local task force or working group consisting of more or less 20 people from local organizations, institutions, authorities. We got a support from the office of the government. We asked for the money and we got the money. We also got the support from the regional government and the local government of the city, and not only financial support, but big, I would say, political and moral support, yeah, from them. So finally, after the preparation phase, which also included how to say that, advocacy at the national level, we have prepared a concept of drug consumption room in the Czech Republic, yeah? Taking into account the Czech context, the Czech legislation, and so on, and we propose a model how it can operate. So with this, we simply opened, we bought the second-hand ambulance. You see the picture from the first days of operation. It was very simple. We just removed the equipment of the ambulance and put there the table and so on and so on. Then we opened it officially the 19th of September 2021 with some media attention. On the picture on the left up, you see me and Mayor Malecek from the district Brno North, which is crucial, I mean, for us, for the support, and crucial partner in all what we do. Top to down on the right, you see the small team of drug consumption room within the outreach program. This is after the reconstruction of the inner space of the cabin. So it's nicely, I mean, renovated with the how to say that, the place where people can wash the hands, and there are 3 places now, yeah, for the three consumptions going in parallel. It doesn't work, yeah. So now it operates 4 hours a day from Monday to Friday. So it's very limited. You can see the coverage or the capacity we can provide to people is quite limited, just 4 hours a day. The rest of the day and night they are simply using elsewhere. They had to. It's not open. It's operating as integrated service as part of the outreach program, providing other services. So on spot there are 2 or 3 cars basically operating at once. One of them is the ambulance for drug consumption room. What else? And of course other services, including syringe distribution of paraphernalia, naloxone, and so on and so on. We are working with the public, of course. It doesn't work, sorry. It looks like, yeah.
The battery.
Okay, battery. We did an evaluation of that prior we started and after. We did 2 cross-sectional surveys. We produce publications. The first one has been published, and other ones are on the pipeline. Basically, the basic findings are: we attracted the most vulnerable part of people who use drugs in the city, in the districts, clients from the socially excluded district location, clients from Roma community. So quite promising results. You can read it in a paper which is now already on. Others are coming. Now it's good. I mean, it's good coincidence that Susan mentioned this legislative framework. I also have 2 last slides on that. So Simply, it is first and only so far drug consumption room in Czech Republic, despite we have tried in the last 30 years many times, especially in Prague, where is the clear need for a program of this type. You see there like 3 waves of intensive trying to open it. Yeah? It started at the end of 90s. Maybe you remember our friend Tomáš Zábranský, who was involved in that time already, and then other waves. But in Prague it didn't happen so far. But Brno, you know, there is a big rivalry between Brno and Prague. Yes? So now Prague is looking at Brno and thinking, well, if it's in Brno, so we have to open it finally also in Prague. So it's somehow going on, the preparation, and it will be open soon, I hope. And of course, those the problems, those barriers due to restrictive legislative and administrative framework are documented elsewhere, not only in drug consumption rooms, but also towards harm reduction services in general. I have some references here. And in Czech Republic, it concerned basically clients as well as professionals or service as such, this risk of criminalization. Clients for possession of drugs and professionals for the specific crime in Czech Republic, which is called promotion of toxicomania. So, but in this concept, we have performed, there is a mistake, legal analysis, where based on the jurisdiction and the court decisions, we simply interpret the possession of small amount of drug to be used shortly after the possession as a use, which is not criminalized in Czech Republic. Yeah? There is even a specific term for that, spotřební držba, which is different from possession, right? So simply we use that interpretation. We clearly said we base our program on that, and we involved local police and municipal police into this task force, and so far there is no incident. And then, after we opened, we agreed with the national police simply to clarify the situation finally and to work on the explicit decriminalization of this kind of service. And now we have amendments to decriminalize it explicitly in a legislative process in the parliament, basically. So hopefully it will be changed soon, and here you can see how it can look in the spot in Brno. Thank you much.
Yes, thank you. I have, so both Hugo's and Victor's DCRs are contributing to our Sentinel DCR data collection that we are performing in cooperation with the EUDA. And I prepared some of the data at the European level from 2023 that we have. I'm not going to talk about them for obvious reasons, but I will just put this piece of paper round. So if you are interested in receiving like short presentations with this data, just put your email address, and I will prepare something instead of presentation today, and I will send it to you. Okay, so you can put your email addresses there, and like the very short kind of essence or kind of bites from this data collection exercise. You can read here. We basically collect the data about the characteristics of the visitors, gender, age, about consumption, number of consumption episodes per substance, per route of administration, and the emergency episodes, overdoses basically, and responses to them, and severity level of emergencies in the DCRs. So yes, I think I would finish here, and if there are any questions, then I will just point to you. I will not invite you. So is there anything, Dominic?
Hi, Dominic, representing the Drug Information Center in Zurich. I just wanted to reflect on something that you mentioned, Susanna. If I got it right, you described the dealing inside of the facility as a risk. And I'm fully aware that the political situation in Italy is different than it is in Switzerland, but I would describe it as the opposite, because what we learned to have good collaboration with neighborhood. For neighbors of a drug consumption room, the main concerns are using drugs in front of their buildings, in parks they're using, playgrounds they're using, and this small-scale dealing. So what we decided to do is, like, this is, I would say, a very pragmatic approach to say, this small-scale dealing is happening anyway. I mean, people who are using those drugs are not reducing them themselves. So it's this illegal market is happening anyway, and the question is just whether we want to have this situation of small-scale dealing in public spaces, or if you want to have it inside of the facility, where you have a certain control, where you can also reflect your people, you also can a bit manage like the amount of, but it's only users, people who use drugs, who sell drugs, like small-scale amount of drugs to other people from the facility.
Okay. No, I wanted only to stress that many DCR are also very rigid protocol.
Yeah.
I've in mind the 10 rules in Germany, for instance, and they are very rigid. At one of the aim of this protocol are just to avoid dealing inside. So you are talking of another model, I think. Okay.
Any other questions?
Is there any other question? No. I just wanted to say thank you for inviting me, because I have learned many things about the legislative analysis, about the evaluation toolkit as well. Yeah, this is something, because we are starting evaluation now, really follow up with the clients of the service. It has settled somehow after 1.5 years, so it's a good time to start with this. So I'm interested in this evaluation toolkit, because we are just preparing our design and the protocol and the tools. So great. And thank you.
Amazing.
Thank you also
Thank
Hugo.
you. Yes,
Hugo,
thank
yeah.
you, everyone.
Hugo for inspiration, and also all of you. Really, it's so important to exchange and to let people know what's going on.
Yes. Thank you for being here. And yes, I will, if you want to put your email still, I will wait for a couple of more minutes so all of you can put. You can access this website of European Network of Drug Consumption Rooms through this QR code. And if you are operating a DCR in Europe or planning to, and you are not a member yet, there is a big button to join the network. So you are most welcome to do so as well. Yeah, thank you very much.